Welcome back to Face the Nation. We learned early on in this pandemic that the coronavirus disproportionately affects communities of color. Saturday, we spoke with Dr. Marcella Nunez-Smith, the chair of the COVID-19 Health Equity Task Force, about how the Biden administration plans to tackle the problem of racial health disparity. Doctor, our new CBS News poll shows that vaccine hesitancy has actually ebbed among racial minorities, and that started about mid-January. We are now seeing that Black Americans are as likely as white Americans to say that they're willing to get vaccinated. Are you also seeing that shift?
Yes, this is great news. We see vaccine confidence growing in all groups across the country. And so now the work is to make sure that people can connect with vaccine when they're eligible. But it is very promising. I'm hearing the same thing, that confidence is high. We are at a great moment. We have 3 vaccines authorized in the United States for emergency use, and people are getting more eager to get connected with those. So
is vaccine hesitancy no longer an issue?
You know, we absolutely have to meet people where they are, whether we are talking about vaccine confidence or really engagement with healthcare more broadly. You know, there are institutions, unfortunately, when we think of our history, both in terms of healthcare, even at times the federal government, that have actively earned distrust in many communities, including communities of color. The reality is that the process has been data-driven, grounded in science, thoroughly and rigorously reviewed by independent scientists. We've had diverse scientists at every step of the way, and also who was involved in the clinical trials. I'm so grateful to the scientists and the clinical trial participants. You know, over 30% of them identify as diverse. So these are some of the key bits of information that trusted messengers across the country are getting out. I think it's making a huge difference. We're starting to see those shifts, as you mentioned, in vaccine confidence.
So one of the areas where we are still seeing hesitation is, according to our CBS News poll, is among partisan lines. In fact, unwillingness to get the vaccine is higher among Republicans, specifically younger Republicans. I'm wondering what your plan is to reach them.
I think one of the other tragedies of the pandemic has been how it has been so politicized, where we see kind of the politicization of just basic public health practice, wearing masks, which we know works and we're asking Americans to do for a bit longer. But we are hopeful, and we know that the vaccine is just a clear path to getting to the other side of this pandemic. So we recognize that we have kind of unique messages for different groups. That's so important.
But how do you persuade people who aren't supporters of the president? Are you going to launch public service ads here, reaching out to celebrities who may appeal to these constituents? I mean, what is the way in?
We are absolutely aware of the need to reach out and reach across. That is a core principle of this administration. We want to make sure we are meeting everybody where they are. And to your point, we're getting ready to launch that national public education campaign. We'll work closely with trusted messengers, influencers, and others to get to everyone, whether the hesitancy is based in
when will that
be, or anything else. So we are on the cusp of launching that national public education campaign, timed really appropriately with that increased supply in vaccine that we see coming right down the pike.
The administration is now going to be directly supplying vaccine doses into community health centers. What does bypassing the governors and going direct to these centers accomplish?
So, you know, I always say equity is a team sport. We're going to continue to work so closely and collaboratively with state and local leaders as we have been this entire time. And there are several federal programs that directly supply vaccine, and all of those have been designed with equity in mind from the beginning. And that includes the community vaccination centers, those mass vaccination sites, and we have located those in those areas that are hardest hit using best practice to make sure people can actually overcome many of those structural barriers to get registered and get vaccinated, as well as the retail pharmacy program.
So what is the thought behind making doses available to dentists and podiatrists and veterinarians, new providers here? Is the idea that you go in for your teeth to be cleaned and you get a shot in the arm with the COVID vaccine?
So we're very excited to have also announced this week expanding who can vaccinate. You know, it's so important. The core of this work is making sure there's more vaccine, and we have pushed on that. You know, making sure that there are more vaccination sites and venues. All the people you mentioned will be able to vaccinate, and we encourage them all to go to phe.gov and sign up, see what your state needs and where your state needs you. And so the idea is that these vaccinators will be able to plug into a lot of these existing vaccination venues and give vaccination there.
I know you've talked a lot about this, and you've said a person's zip code is a stronger driver of health than their genetic code. Tell me what you're doing to actually get better data, because we know the CDC has reported that race and ethnicity is only available to them for about 53% of all the people who've been vaccinated. So they've only got a partial snapshot of what this country is actually doing. So why can't the federal government get a handle on it?
Yeah, this is a key priority. We need better data to know where to target resources. We are working very closely, again, with both providers as well as state and local health officials. We've already seen great partnerships in that space, and we're seeing the completeness of our data increase. The equity metric toolkit is growing.
So how do you actually measure whether what you're doing is successful or not?
So we, again, will keep pushing to get better, more complete data around variables that are important and relevant, like race and ethnicity. And alongside that, we have been using other equity metrics, and so things like social vulnerability and zip code, and we can do those analyses now to keep track. And
but
we have
can't the
already
president mandate that?
I think our first step in this process has been to work very collaboratively with states and locals. We're working to overcome any challenges that might exist in terms of just data systems and infrastructure.
If you look at the U.S. border right now, there are about 8,000 unaccompanied migrant children in the custody of Health and Human Services. And COVID distancing policies have been lifted inside of those federal facilities just because there are so many kids there. Are you concerned that this is a real health risk?
We definitely are concerned so much for the children who are there at the border for so many reasons, including health. And so this is absolutely something that, as a response team, we're focused on and thinking about.
So the governor of Texas has said that some of these undocumented migrants who are crossing into his state are spreading the virus. Have you seen any evidence to support that?
You know, I have not seen any evidence to support that at all. I mean, I think that it's very important for us, you know, again, as we talk about our goal to vaccinate an entire nation, that we not divide ourselves in this process. You know, it's key. Vaccinations are free. We need to make them easy and convenient, and we need to make sure everyone knows that regardless of documentation status or anything else, quite frankly, that you are eligible for vaccination here.
All right. Dr. Nunez-Smith, thank you very much for your time today.
Oh, thank you so much.
You can see more of our interview on vaccination.com. We'll be right back. We go now to former FDA Commissioner Dr. Scott Gottlieb. He sits on the board of Pfizer as well as Illumina, and he joins us from Westport, Connecticut. Good morning to you.
Good morning.
Dr. Gottlieb, I want to ask you about the mayor of New York, who appeared to be disagreeing with Dr. Fauci, because Dr. Fauci said these new variants that they're tracking in New York City are showing resistance to therapies and to the vaccines. The mayor of New York said his health department said that the vaccine works, and in fact, he said we're not seeing reinfection of people who've had it previously. What's going on in New York?
Yeah, the trends in New York look concerning right now. If you look at other parts of the country where B117, that variant from the United Kingdom that we've been watching, is becoming very prevalent. So Florida, where it's about 50% of infections, Texas, it's about 40% of infections. You're not really seeing an upsurge in infections. You're seeing perhaps a plateauing, but you're not seeing this sort of fourth wave that we feared, even as B117 starts to take over. In New York City, as 1526, that new New York variant, and B117 start to become more prevalent, you are seeing a backup in cases. You're seeing a plateauing. Hospitalizations are still declining slowly, but it's kind of plateaued. New cases are about 3,000 a day. The positivity rate's about 6%. It's been that way for a couple of weeks now. And so you're seeing sort of a backup in New York that you're not seeing in other parts of the country. So there are some concerning trends. Now, with respect to that new variant, that New York variant, 1526, we are concerned about that. Right now, of the samples being sequenced that have what we call this S gene dropout. So they're samples that we're sequencing because we know they're variants. About 40% of them are this 1526. And New York is really the only place in the country right now that we know of where 1526 is that much of the infection. And about half of those cases, so half of the cases of 1526, have the same mutation that's in the South African variant, this 484K mutation that could make the virus more impervious to our vaccines. So it is a concern. We also are seeing with the 1351, the South African variant, with this same 484K mutation, we're seeing people get reinfected. And so whether or not that's starting to happen in New York and that explains these trends, we don't know yet. It's still early, but there's a lot of reasons to be concerned about the trends in New York City.
From your perspective, is it too soon then for the mayor to be telling people to go back to the office in May, to be telling high schoolers to go back to school in person as soon as next week, to be going back to higher capacity seating in restaurants?
Look, I think we're going to know in the next 2 weeks where the trends are heading in New York City. It's hard to know for sure which way we're going to head. But right now, the data in New York looks more concerning than other parts of the country. There's other parts of the country that have opened up liberally, have a lot of B117, and aren't seeing the same trajectory that New York is. Now, it may just be a backup and we continue with the declines in New York like we're seeing in other parts of the country in the next 2 weeks, or it may be the start of an upswing. We don't know. I think the next 2 weeks are really going to be a critical period. I would be cautious in New York because if 1526 is partially explaining what's going on in New York City, that could be really concerning. There's ways to explain what's happening in New York that aren't as concerning, that mean, this is just sort of a temporary blip and will continue on the declines. And then there's ways to explain it that would cause a lot of concerns, including that 1526 mutation.
So one of the hedges at the end of President Biden's very hopeful speech about COVID was these new variants. He said, we're watching them. But he did put that July 4th date on the calendar for gathering. Is that a realistic timeline?
I think it is. I think most of the country is going to look much better well before that. I think you're seeing cases decline all around the nation. Even in parts of the country where 117, that UK variant, is becoming very prevalent, you're still seeing continued declines, albeit more slowly. I think the combination of a lot of prior infection and the fact that we're vaccinating aggressively now is enough to keep up with that and hopefully get ahead of it. So I think as we get into April, the situation around the country is going to look markedly better. But there will be pockets of outbreaks, and there will be pockets where some of these variants become more prevalent that could look bad, even though the rest of the nation is going to look very good. And New York is one of those parts of the country right now that if you look at New York, there's some concerning trends there. Even while the other parts of the country are improving, New York does seem to be plateauing. So I think overall the trajectory for the nation continues to look good.
You've been saying watch Europe as an indicator of what may be happening here. Europe's moving pretty slow on their vaccinations. Italy is looking at a lockdown over Easter because of what they're seeing. Should we anticipate that's what's going to happen here?
Yeah, through this whole pandemic, we've been about maybe 3-4 weeks behind Europe. So we've used Europe as a barometer to what's going to happen in the United States. I think the tables have turned, and I think we're ahead of Europe because we're vaccinating so much more aggressively. Eastern Europe looks very bad right now. Italy looks bad. But I think the U.S. is in a much different situation through a combination of the fact that we have a lot of prior infections, so there's immunity in the population from prior infection, and we've now vaccinated 25% of adults. We're vaccinating probably about 1.5 to 2 million new people a day. We vaccinated about 65% of those above the age of 65, about 75%, almost 75% this week of those above the age of 75. And we're seeing the benefits of that. A 96% reduction in nursing homes where we've had very good penetration with the vaccine. So I think we're in a different situation than Europe because of the vaccine-induced immunity that we're getting into the population.
Pfizer, where you serve on the board, their CEO said this week that he's seen the vaccine block 94% of asymptomatic infections. Is that the final word showing that if you're vaccinated, you cannot spread the virus?
It's an important data point. And this comes out of real-world evidence from Israel. And all of the evidence across all the vaccines now is pointing in the direction that these vaccines reduce asymptomatic infection and reduce transmission. We've always believed that they're having that effect. We didn't know the full magnitude of that benefit. But all of the incremental evidence coming out suggests that the impact on the reduction in transmission could be quite strong. And if that's the case, the vaccine creates what we call dead-end hosts. A lot of dead-end hosts, meaning people will no longer be able to transmit the infection. And just like you get exponential spread on the way up in an epidemic, if you can get a whole bunch of immunity in people where they can no longer spread the infection, that has a compounding effect on reducing the scope of the epidemic. So if, in fact, this vaccine has a substantial impact on reducing transmission, it's going to become a very important public health tool in controlling the epidemic.
All right. Dr. Gottlieb, thank you for your analysis. We'll be back in a moment. Last year, Ireland's Prime Minister did travel to Washington just before St. Patrick's Day, but the formal celebration was canceled due to the pandemic. This year, that meeting with President Biden will be virtual. Taoiseach Micheál Martin joins us now from Dublin. Good morning to you.
Good morning, Margaret. Good to talk to you.
Great to have you here. The Biden administration has renewed that ban on travel from Europe, including Ireland. And I wonder, given progress with the pandemic, do you expect it to be lifted perhaps this summer?
Well, that depends, and we're similarly have significant restrictions on travel into Ireland and indeed across Europe. As the vaccination programme rolls out, I believe opportunities will arise, but it's just far too early to say yet, and particularly in the context of the summer, we have a significant journey still to go in terms of vaccinations and in terms of keeping the virus down, because as you know, in some member states of the European Union now, the numbers are going back up because of the prevalence of the B117 UK variant, which is much more transmissible.
You just gestured to the fact that the EU is significantly behind in vaccinating its own citizens, and that includes your constituents. When you meet with President Biden this week, will you ask him for vaccine supply from the U.S. stockpile, since that's a big issue?
Well, I think I'm not aware of too many countries that are giving their vaccines away. I think more critically, we will obviously discuss COVID and we'll discuss vaccination. The critical point, I think, for all of us to bear in mind is the fact that this is a joint enterprise in terms of vaccine development and vaccine production. These companies, J&J, Moderna, Pfizer-BioNTech, AstraZeneca, they're all partnerships between US and European companies and involve companies that have global, integrated global supply chains. So different component parts of vaccines are developed in different parts of the world.
Well, the New York Times reported that the Biden administration had denied a request from the European Union to loan out AstraZeneca and Johnson & Johnson vaccine doses to the EU. Will you ask President Biden to reconsider that?
Well, I think that whole issue around AstraZeneca, there's been significant difficulties between AstraZeneca and Europe in terms of AstraZeneca fulfilling its contractual commitments to Europe, and they haven't been in a position to do that and have fallen very far short of what they committed to Europe. But as I say, I'm not preempting any discussions I will have in detail with the President, but obviously the broader COVID vaccination issue will of course be discussed.
Tensions have been spiking in Northern Ireland, as you know. The British government has not been honoring all the terms of its divorce from the European Union. Now you also have Northern Irish paramilitary groups saying they're temporarily withdrawing support for the Good Friday peace agreement due to other complications. Are you going to ask President Biden to intervene or appoint an envoy?
Well, first of all, I will be thanking President Biden for his steadfast support of the Good Friday Agreement and of peace in Ireland. And I'll also be thanking the Friends of Ireland and the Vice President and Speaker Nancy Pelosi for the consistency of their support for peace in Ireland, and that has been positive in terms of influencing, the journey of Brexit itself. And we knew Brexit would create challenges, and it has. It hasn't been easy, and Brexit is only 2.5 months old since Britain has formally now exited the European Union.
Do you need U.S. help with that?
Yes, we want to see a continuation of the President's interest in Ireland and support of the peace process and the Good Friday Agreement, and also of upholding the Brexit Agreement itself. And I've no doubt that the President will continue that interest and will use his good offices and the administration's good offices to bring the right outcomes there.
Is that a nice way of saying you need him to lean on Boris Johnson to stick by his commitments? Because as a candidate, Joe Biden said the UK wouldn't get a trade deal unless they honored the peace deal.
Yeah, and in fairness, as I've said, the support of President Biden in recent times and throughout the years has been influential, and it's been effective. We also in Ireland here have to work on a post-Brexit relationship with the United Kingdom, and we're doing that. And I get on well with Prime Minister Boris Johnson, and we will be working out issues post-Brexit. We have to develop a stronger structure now for British-Irish relationships in the aftermath of Britain leaving the European Union. But part of that whole relationship is the US engagement and connection, because having been involved at the time of the signing of the Good Friday Agreement, I'm under no illusions about the significance of the American involvement and engagement with all sides and all traditions and all perspectives on the island of Ireland and with the United Kingdom.
Any indication if President Biden will visit Ireland in June?
Not yet, but when I spoke to him in November, I invited him to Ireland, and he just said to me, try and keep me out. So that means it's a live possibility. At any stage, it's a live possibility that President Biden could arrive on our shores. And I can tell you, he will be most welcome, because we really appreciate the warmth that he has for Ireland.
All right. Taoiseach, thank you very much for your time. Happy St. Patrick's Day.
Happy St. Patrick's Day, Margaret. Thank you.
We'll be right back. On our latest Facing Forward podcast, I spoke with Sally Krawcheck, CEO of Elevest, who says the pandemic has wiped out decades of economic progress for women, and old gender roles are coming back. You can subscribe on your favorite podcast platform. Until next week, for Face the Nation, I'm Margaret Brennan.